Imagine stepping into a tub of ice water, gasping as your body screams in protest. But what if that shock could actually heal your mind? This is the power of cold exposure on mental health. On a January morning in 2016, a 34-year-old software engineer named Michael stepped into a plastic tub filled with ice water in his Brooklyn apartment. He shivered, gasped, and stayed for 11 minutes. Within weeks, he reported a dramatic reduction in the depressive episodes that had plagued him for a decade. While anecdotal, Michael's story is not unique. Across the globe, from the Wim Hof acolytes in Amsterdam to the traditional winter swimmers of Finland, a growing body of evidence suggests that deliberate cold exposure, whether through ice baths, cold showers, or cryotherapy, may have profound, measurable effects on mental health. But is this a legitimate therapeutic tool or just another wellness fad? The research, still nascent but increasingly rigorous, suggests the answer is far more complex and promising than many assume. To understand cold's psychological power, we must first examine the physiological shock it delivers. The human body is a warm-blooded machine, optimized for an internal temperature around 37 degrees C. When immersed in cold water, typically 10–15 degrees C, the body initiates a survival response that reshapes brain chemistry. This cascade begins with a dramatic increase in dopamine. In a landmark study by Cox et al., published in the Proceedings of the National Academy of Sciences, researchers found that a single session of cold exposure increased dopamine levels by 250% above baseline. This surge is not a fleeting spike. It persists for hours after rewarming. Dopamine is the neurotransmitter of motivation, reward, and focus, the same chemical targeted by many antidepressants. Unlike the artificial boost from drugs, cold exposure triggers a natural, sustained elevation that may help counteract the low dopamine tones seen in depression and ADHD. Cold also activates the sympathetic nervous system, releasing norepinephrine, a neurotransmitter that sharpens attention and primes the body for action. A study by S. Ramick et al. In the Journal of Applied Physiology showed that cold water immersion increased plasma norepinephrine concentrations by 200–300%. This fight-or-flight activation, when brief and controlled, can reduce baseline anxiety over time by teaching the brain to manage acute stress. It is a form of hormesis, a small, controlled dose of stress that strengthens resilience. The body learns to adapt, building a psychological toughness that extends beyond the cold. This mechanism may explain why regular cold exposure is linked to lower cortisol levels, as seen in Finnish winter swimmers. The result is a calmer, more focused mind, better equipped to handle daily pressures without overreacting. Cold water also triggers the release of endorphins, the body's natural opioids. This explains the analgesic effect reported by winter swimmers and the sense of euphoria that often follows an ice bath. A study by Dunn et al. In Medical Hypotheses proposed that the endorphin rush from cold exposure could be harnessed to treat chronic pain and mood disorders, though the authors cautioned that individual responses vary widely. This natural high is not just a fleeting pleasure. It may offer a sustainable alternative to painkillers for some. The combination of dopamine, norepinephrine, and endorphins creates a neurochemical cocktail that can elevate mood, reduce pain perception, and foster a sense of well-being. It is a remarkable example of how the body can produce its own medicine with the right stimulus. Perhaps the most cited study is by Van Tulleken et al. In the British Medical Journal Case Reports. The authors described a 24-year-old woman with treatment-resistant depression who began a program of weekly cold water swimming. After several months, her symptoms remitted significantly, and she was able to taper off her antidepressant medication. While a case report cannot prove causation, it sparked interest. A larger observational study by Huttunen et al. In the International Journal of Circumpolar Health followed 85 winter swimmers in Finland and found that they reported significantly lower levels of tension, fatigue, and depression compared to non-swimmers. The swimmers also showed lower levels of cortisol, the stress hormone, after immersion. These findings suggest that regular cold exposure might offer a powerful, drug-free adjunct to traditional treatments for depression. A more controlled experiment by Buys et al. In the PLOS, one journal tested the effect of cold showers on 3,018 Dutch participants. The study found that those who took a 30 to 90-second cold shower at the end of their morning routine reported a 29% reduction in sickness absence from work over a 3-month period. While the primary outcome was physical illness, the researchers noted improved self-reported energy and mood, suggesting a psychological benefit that may reduce burnout and absenteeism. This simple, accessible intervention, requiring no special equipment, could have widespread implications for workplace mental health. The consistent practice appears to build a buffer against stress, making individuals more resilient to the daily grind. It is a testament to how small changes can yield significant results. Whole body cryotherapy, WBC, which uses extremely cold air, -110 degrees C to -140 degrees C, for 2-3 minutes, has also been studied. A randomized controlled trial by Masuska et al. In the Journal of Affective Disorders assigned 40 patients with anxiety disorders to either WBC or a sham condition. After 10 sessions over 2 weeks, the cryotherapy group showed a 50% reduction in anxiety scores, compared to 20% in the sham group. The effect persisted at a 1-month follow-up. The authors hypothesized that the anti-inflammatory effects of cold, which reduce cytokines linked to depression and anxiety, played a key role. This suggests that cold exposure may work on multiple levels, both neurochemically and immunologically, to calm the anxious brain. It is a promising avenue for those seeking non-pharmacological interventions. Given the evidence, how can someone safely harness cold exposure for psychological benefit? The answer is not one size fits all, but several principles have emerged from the research. Experts recommend beginning with a 30-second cold shower at the end of a warm one. This is the approach tested in the Buet study. The key is consistency, not intensity. A daily 30-second cold blast can reset the nervous system without overwhelming it. Over weeks, you can gradually extend to 1-2 minutes. Temperature matters. Aim for water around 10-15 degrees C. Listen to your body. Never force yourself to stay in if you feel dizzy or numb. The goal is to build tolerance and reap the mental benefits, not to endure unnecessary risk. With patience, this simple practice can become a powerful tool for mental resilience. Cold exposure is more than a trend. It's a science-backed tool for mental resilience. If you found this valuable, consider exploring the cold yourself, starting small and safe.